Hi, Nicole Kidd, Redmond Research. In light of the economic situation and budgets, do you see more hospitals being developed, or are a lot of them on the drawing board and are not being developed?
I can probably address that from the 75 organizations that work with us. Over the last couple of years, we've seen a stall in their projects, but not necessarily an abandonment of their project. Here in the United States, some states have to go through a certificate of need process, and that has stalled as well. So it's just kind of stalled. But in the last 3 or 4 months, actually, the bit of activity has kind of reignited. But I also would want to say that a lot of the examples I highlighted were from the acute care side. And since the healthcare reform package and the stimulus funding has really kind of shaped new ways of thinking about building in the healthcare environment world, we've seen a lot of interest from community health centers, safety net clinics, ambulatory care centers, MLBs, and so on, to really see what research is out there. And they're actually doing more work than, such as like a $1 billion replacement hospital project per se.
In Denmark, the activities will be very high for the coming 10 years. I think we haven't built so much hospitals since the 70s in Denmark, so there will be a huge among a lot of hospitals are going to be built in the next 10 years.
I think in the acute care setting, there are the large referral hospitals like Stanford. We're moving ahead. A lot of smaller projects, more experimental projects, if we want to call that, new hospitals, systems who would like to build hospitals. In this area, groups who wanted to build 100, 200 bed, smaller community hospitals. Those projects have definitely stalled, and many of them have stopped. So in our planning at Stanford, we actually service both community physicians as well as our own academic staff. And there was, at the beginning of our planning effort, there was a lot of discussion that the community physicians would build their own facility. I don't see that happening now. So suddenly, the larger institutions that are established are probably going to be picking up more of the population. So I see that there's a balance related to that we're probably going to not see very many small new hospitals under construction. But certainly of the top 20 academic medical centers in the United States, 20 of them are planning projects right now.
Actually, I'd like to ask the panel one quick question before we end, which was inspired by John's dilemma. And I don't want to think of this as weaponry for the devil as such, but perhaps more ways of helping the angel to loosen up a little bit. So from each of you, if you could only choose one tool or technique to help you think about the future, to future-proof your plans, what would it be? What is it that you use every day that works really well?
So I'll start that because I have a very strong opinion on that. Just as a designer, I have a kind of limited perspective, I guess, in a way. But the future is so totally uncertain. Planning for the future, you don't know what technology is going to be. It's hard to predict costs. But one thing you can align around is a human experience. What is the experience you're trying to create? And so I'd say the tool I would take to any challenge is trying to put yourself in the user's shoes, in the experience that exists now, and trying to really draw from that some lessons which tell you what really matters, so that you can use that as a tool in the future to help you make decisions. But actually try and capture some kind of experience blueprint, some kind of journey that you're trying to create.
I would probably add to that. For me, I'm very indecisive. I would not want to choose just one, frankly. But I would, if I had to choose just one, I would probably add to the user experience and say the community experience, especially for healthcare. It's extremely crucial to rely on your peers and other industry partners and any other innovative ideas that kind of emerge from outside of healthcare that kind of spurs innovation. So I would say the community would be my one. That's a big one.
That is a big one. Great, thank you.
I think that it's really important to face that the only thing which is sure is that the future is unsure. So we have to build a lot of flexibility and possibilities into our buildings, and I think that's a tool I will use in my project.
Well, I want to iterate the first comment, because that's truly what it's all about. The things that don't change are the things you need to look at first, and that's human interaction, basic psychological experience, etc. Those things don't change while the technology of what procedures, how these other things may happen change. Those things that don't change are things that you can respond to and actually feel that that response is going to continue on. The second comment related to, we steal all the time, blatantly steal from everything we can, but a lot of that is not from the healthcare environment. A lot of it from the experience issues will come from areas of hospitality, retail, banking, all these other things where people are dealing with huge amounts of material and know how to respond in the human way. But also just from a planning piece, that major healthcare facilities are turning into cities. And when you say a community, we're building communities. If you look at a place like Texas Medical Center, TMC is bigger than downtown Houston. And so you have these environments that basically have to respond to the same issues that any city needs to respond to, which is infrastructure, transportation, future growth issues, flexibility, generic planning. I mean, the city block and the grid works in healthcare planning as it does in the city planning piece, and not to deal with specificity at the time you're developing a project. From the beginning thoughts of our project to opening day is about 10 years. Anything that's specific and built 10 years ago, people are going to say, what were you thinking? And we were thinking pretty well 10 years ago, but so many things have changed. So to allow for that flexibility and allow for space for flexibility to happen. So people always say, you know, well, how efficient can we be in that space? And you can be too efficient to make it impractical to develop in the future. And that's especially true in areas such as information technology, mechanical electrical systems, etc. That's where you can mess this thing up very easily. If 10 years later you have an IT closet that's a quarter of the size of what you need to think about those things now. Okay?
And I think a very important point is that we should be inspired from other kind of industries. I mean, we're just in the bus here, so we talked about the barcode reader. And should we invent something special for the healthcare? No, we could go to a Woolworth store or something where I've used it for many years and to be inspired of other industries.
Our own experience. Well, I want to say thank you once again to our speakers for their experience and their wisdom.